Myocardial infarction, when the supply is suddenly decreased or stopped of blood, and myocardial tissue infarcted. Diagnosis will be by history, EKG, and angiograms. EKG or ECG, different places you'll see EKG. EKG is an old way of writing, and the correct word ECG, but you will see some providers will write EKG. Laboratory workup will include cardiac enzymes such as troponin and CKMB. And again, you need to remember that troponin, at least in the context of this text and this course, is a cardiac specific. CKMB may signify other diseases such as diseases of damage to skeletal muscles such as rhabdomyolysis. And treatment will include revascularization, will create, we can do cabbage surgery or CABG. Some people have a real hard time saying cabbage regarding heart, and you need to say CABG, or you can try to revascularize them by cardiac cath and angioplasty, trying to compress the existing plaque or trying to put a stent. Just a couple of words about healthcare costs. Of course, CABG surgery is a state-of-the-art surgery, but it's very expensive. Cardiac catheterization is one of the innovations that replacing the CABG surgery for some patients, and the cost is, of course, it's much lower. So we see in these cases that innovation will be introduced in healthcare and will be overall contributing to reduction of the cost. So let's talk about treatment in more details. Angina or angina treated with vasodilators such as nitroglycerin, and stable angina is not, of course, what you want to see in your patients, but if it's managed with nitroglycerin, you may opt for that option. If there are no other options, let's say patient's age or other comorbidities doesn't allow for patient to undergo bypass graft surgery, and angioplasty is again less invasive option versus CABG, and may be introduced by cardiac cath. Coronary artery bypass surgery is a significant intervention, and of course we know that thousands of them done a year in even here in Nashville area, and we have a great facility right next door. However, it's still a major surgery and major risk factor for the patient, a major recovery time and disability, at least for some time for the patient. So what I'm trying to say, when you practice, try to advertise or do propaganda, call it the way you want to introduce these three things here on this list: diet, exercise, and the reduction of smoking. These are three important contributing factors that may make it or break it, and they may reduce the risk of adverse effects of the disease. This introduction of proper diet, exercise regimen, and elimination of smoking can significantly reduce the healthcare cost and healthcare. And let's forget about the cost, but you truly don't want, as a healthcare provider or nurse educator or a nurse or physician assistant, I don't know, dentist, your patient undergoing major surgery. You want to prevent it, and prevention is really truly cheap. So elimination of the high calorie diet, reduction of the calories, exercise regimen, and again reduction of smoking. For some reason the efforts to decreased smoking were dying last few years. Of course, we don't have TV advertising of smoking, but we still see it in magazines. We still see colorful cigarette packaging. We still see teenagers and preteens, even some places, smoking as well as using tobacco, which to me, living in 21st century, it's truly unacceptable. So try to use prevention in your interventions, and believe me, if you spend time, there are numerous studies done, if you spend time on prevention measures, you will be rewarded, and morbidity among your patients will be reduced. Deep vein thrombosis is one of the topics you are very familiar with, and just to refresh the mind, thrombus is a clot that sits and doesn't move. Embolus is a clot that already moves and travels and can go to other places like brain and heart. To treat this, you may elect to give heparin to reduce the size of the clot, or in which can be regular heparin or low weight heparin such as Lovenox in this case. And prevention, always the key. If patient is under the risk, you may elect to give low weight heparin, as well as use sequential compression devices in lower extremities to prevent this. Next, I would like to talk about it's the rheumatic heart disease and the damage it can cause. Rheumatic heart disease is a sequela of streptococcal throat infection. That's why we are so concerned with doing strep A testing in patients who present with laryngopharyngitis or pharyngitis to define and eliminate the streptococcus A. However, even with the best testing technique, there is a chance that streptococcus A won't be identified, even patient has the actual infection. So in case if you clinically believe that a patient has strep A, you may opt for treating it with antibiotics, and I know this goes against what I was saying before, try to give it a time, but strep A needs to be treated right away. You do not have waiting time. You cannot give 1 week wait and see if it's a viral infection that may be cleared out. Usually strep A has significant appearance in pharyngeal appearance, and you may be even clinically able to diagnose it. So the sequela is developing rheumatic fever, and as a consequence of rheumatic fever, where the valves can be affected. All layers of the heart, endocardium, myocardium, and epicardium may be affected. However, the main concern is valvular deformities secondary to this, and valvular disease. Treatment, again, will include prevention, treatment of streptococcal infection, and if patient develops rheumatic fever, of course it has to be addressed, and one of the simplest things to do is rest during the acute stage, and if some valvular damage done, it's valvular replacement or valvular plasty with just working on affected valve and trying to correct it. But again, important point here is the prevention and treatment of streptococcal infection. And again, if there is a suspicion, even with negative test, I would suggest to treat it, especially. And in this case, if let's say there is a history of documented exposure, let's say you have 2 children coming to you and you work as a pediatric nurse practitioner, and one of the siblings, 2 siblings, is affected with strep A with positive positive test, the other not, maybe reasonable will be just to treat both if they look clinically similar. Of course, every case is different, and it's hard to make in a lecture like this hypothetical recommendations. But again, the prevention is the main, and treatment of strep infection is the key to avoid rheumatic heart disease.